I'm a doctor who provides medically assisted death in Canada, and I have some huge concerns with the direction this is going. Canada's healthcare system just isn't comprehensive. It doesn't cover medications, it doesn't cover social housing, food, which is medicine, and it doesn't cover mental health, specifically therapy. And you can't cure complex trauma or PTSD with pills. So if mental health becomes an option for people to access a medically assisted death, this means that for many people, good therapeutic options other than death aren't available to them. Many therapists can cure the symptoms of complex trauma and process that trauma successfully. But the most effective therapy, accelerated resolution therapy, that can cost $150, $200 an hour. And this specific kind of therapy is not usually offered by EAP or insurance plans because they always say try CBT. But CBT does not cure trauma. So if this becomes a legal route in Canada, we're going to end up telling people who have significant trauma histories that their best option to stop their suffering is to die. This has been an ongoing problem with many people with complex chronic disease, that the government just isn't allowing them the social housing options, medication options, and treatment options other than doctors and hospitals so that they could survive and thrive. While I strongly believe that medical assisted death is something that should be an option for people, it shouldn't be the best option because our universal care just simply doesn't cover the things that they need. A lot of intolerable suffering is something that can be healed or even cured. I'm really concerned that this has made a slippery slope for people to believe that the healthcare system has let them down and that we are wanting them to make this choice. Medically assisted death should only be made when all other options that are acceptable to a person have been exhausted. And the current health and social systems just don't give people sufficient options. We've fought for the right to death. We need to fight for the right for life.